So I've been asked to speak to you today about Irritable Bowel Syndrome, or IBS, and hopefully after we talk over the next few minutes, I'll have accomplished these objectives to describe the symptoms and how to diagnose IBS, discuss some of the epidemiology behind IBS, outline some of the possible causes, and review some treatment options. So what is Irritable Bowel Syndrome? It's important to remember that Irritable Bowel Syndrome, or IBS, is not a disease, but rather a constellation or a group of symptoms that, when occurring together, form this syndrome that we refer to as IBS. And the symptoms that are often part of this syndrome include abdominal pain, cramping, bloating, diarrhea, constipation, or sometimes both, a sense of incomplete emptying after going to the bathroom, and seeing mucus in the bowel movements. And looking at this list of symptoms, most of us in the room have experienced some, or if not all of these symptoms at some point, which really speaks to the point that this is a very common condition. In fact, up to 20% of North American adults at some point or another will have IBS-like symptoms. Few will seek medical attention for it, but given the large number of people that are affected by these symptoms, it is an important thing to talk about because a lot of people are still seeing their doctors or specialists about this problem. And it's actually the second most common cause for not going to work other than the common cold. So it's an important thing to talk about. Now, IBS doesn't require any special fancy schmancy tests to diagnose. It's a clinical diagnosis, which means you, by talking to your doctor, are essentially making the diagnosis. It's your story that leads the doctor to making the diagnosis. Now, often other tests are done just to make sure that there's no other explanation for your symptoms, but ultimately it's a clinical diagnosis. As Dr. Armstrong mentioned, there is specific criteria defined called the Rome criteria. Although for you or I having these symptoms, it's not particularly relevant to know. Where this comes into play is really doing research on people with IBS and trying to better define exactly who should be considered as having irritable bowel syndrome. So the criteria include recurrent abdominal pain at least 3 days per month in the last 3 months, associated with at least 2 of improvement of that pain after a bowel movement, pain that's associated with a change in the number of bowel movements or the way your bowel movement appears. As we've heard already, there are some symptoms, however, that if you're experiencing are worrisome and should be brought to the attention of your doctor because they might represent something other than irritable bowel syndrome. So the onset of these symptoms abruptly after the age of 50, weight loss, blood, fever, are very unusual and never occur in the setting of IBS and might be the sign of something more serious underlying, such as a cancer. Nausea or vomiting, diarrhea, or pain that awakens you at night also is a sign that your symptoms might be due to something else and are really important to bring up to your doctor. Other tests might be necessary to make sure that an alternative explanation isn't causing your problems. Despite this being a very common condition, we still are not clear on exactly what causes IBS. There's a variety of theories out there, and in a given person with these symptoms, one or several might be at play. So we think that, in part, IBS is due to altered motility of the bowels. Normally, when food or gas pass through you, it's a very well-coordinated orchestra of movement. And in some individuals, that orchestra is a little altered, and things are not moving through you as smoothly as they should be. So gas and fluid build up. It causes your bowels to stretch, and that can be uncomfortable and cause some of the symptoms. We do see that patients following a gastrointestinal infection can sometimes develop IBS. Stress and anxiety certainly play a role. Our bowels are full of nerves, just like our brains. So it's no surprise that in addition to the effect stress and anxiety plays on our mind, it can have a tremendous impact on the function of the nerves in our bowels, which in turn control the way our bowels move and function. So it's always important to address stress and anxiety when we encounter these symptoms. Some people clearly find that certain foods aggravate their problems. So food intolerances is an issue. Overgrowth of normal bacteria has been considered a potential cause. And pain is a very subjective thing, so a lower pain threshold in some people might be a contributing factor. When do we need to treat irritable bowel syndrome? Your patient is not going to tell you that your irritable bowel syndrome has progressed to a vindictive and furious bowel syndrome. It's important to know that most people don't require any treatment, and a lot of people do get reassurance in knowing that this will have no impact on their quantity of life. People with IBS have a normal lifespan and are not at increased risk of colon cancer. Having said that, some people do have very severe symptoms that can have a tremendous impact on their quality of life and require specific symptom-oriented treatment. So dietary modifications are important, encouraging people to have a food log where they can try to point out exactly which foods are responsible for the symptoms is probably the most helpful way in identifying food triggers. It's hard to generalize certain foods that are common offenders, although lactose and some gas-producing foods such as beans or broccoli, Brussels sprouts tend to be common problems, but everyone over time identifies a trigger. Fiber, increasing your dietary fiber or supplementing with fiber can be helpful, especially in people with more of the constipation predominant irritable bowel. Physical activity is important. Given the effect of stress and anxiety in the bowels, some people benefit tremendously from hypnosis or biofeedback. On occasion, we do need to use medications to treat this problem. Antispasmodic medications can help restore the normal movement of materials through the bowels. Antidiarrheal or laxative medications under the supervision of a doctor can be a short-term, from time to time, helpful treatment. Using low-dose antidepressant medications, not for their antidepressant effect, but for their effect on the nerves in our bowels, can be a tremendous help for some patients. And antibiotics have been shown by some groups to help some people with irritable bowel. So in summary, IBS is a group of symptoms. It's very common. It's a diagnosis that you make by talking to your doctor. The exact cause remains unknown. Most people don't require any treatment, but there are a variety of treatment approaches out there. Thank you.